Hello all. While celebrating 100 years of our beloved Professor R.S. Mehta, or RSM as we used to call him, I will be sharing a case with you all. I am Krishna Kishore Oza. I am a student of Dr. R.S. Mehta from MGM Medical College, and I did my internship with Professor R.S. Mehta from 1980 to 1981 at MY Hospital, Indore. I am currently working as a hematopathologist in USA. However, I am trained in both hematopathology and transfusion medicine / blood banking. This case which I am going to share happened 20 years ago when I was working as a director of transfusion medicine and blood banking at the University Hospital in United States. What happens, one day one of my friend and colleague who was working as hemato-oncologist came to my office to discuss a case of 88-year-old woman who was pale and frail and was not able to maintain her hemoglobin levels after repeated transfusion at 2 to 3 days interval. Patient's blood bank history was negative for red cell antibodies and autoantibodies with a negative antibody screen and DAT. There was no known history of bleeding to explain her falling hemoglobin levels. My immediate question to my colleague was, is there a occult bleed like in the retroperitoneum? Did you look for icterus in his patient's eye? And his answer was that he is not aware of any bleeding, but he will check eyes and let me know. In the meantime, I checked the labs and patient's indirect bilirubin was mildly elevated, close to around 2 mg per deciliter. So I strongly favored a retroperitoneal bleed and asked him to check the abdomen. He calls me back from the unit and tells me that patient has mild icterus and the abdomen is tense and hard, and he will order CT scan to confirm the bleed or hematoma. A few hours later, he calls me with the CT result telling me that there is about 3 to 4 liter size of hematoma in the retroperitoneum, and he's calling surgeons to look at it. After surgical consultation, hematoma was drained and the bleeders were tied and cauterized, and patient was discharged happily after a few days. This patient was admitted for 7 days in the hospital and received multiple transfusions before patient was consulted with me. So what was the RSM connection? So what happens during my internship in 1980-81 at MY Hospital, we had a patient who was admitted with pulmonary hemorrhage and was suspected to have good posture syndrome. So RSM was rounding that day and he questioned us all, like RMOs and interns like me, is this a recent hemorrhage or old hemorrhage? And we were all puzzled why he's questioning this and how we will know. And when he looked at our puzzled faces, he explained that an old hemorrhage, depending on the quantity of it, can produce icterus in the eye. And certainly our patient does have mild icterus, and that suggested there was old hemorrhage. And exactly that's what my question was to my colleague. Look in the eye. If there is icterus, there may be a hematoma. Patient may be bleeding. And that's led to this resolution of the above case with a happy ending. So just small clinical things which may look so trivial can sometimes help a complex patient who was admitted for 7 days in a hospital with nobody knowing what's happening. So while it may look trivial, we learned a lot of clinical medicine while working with R.S. Mehta, like looking at the pulses in neck or blood pressure differences in the extremities, or listening to the heart and pericardial rub of uremic pericarditis or seagull murmur of massive cardiac infarct, or just the simple bedside manners, or holding the patient's hand for assurances. So lots of clinical medicine we learned, and when a pathologist get appreciated as a clinician, it speaks a lot for teaching of R.S. Mehta, who was a great teacher, and his legacy runs across not just the internal medicine but all the specialties, and his students are all over the world. So in the last but least, I would like to offer my Sadar Pranam to my beloved teacher and respected Professor R.S. Mehta, and will wish him long life and long live his legacy and his teaching. Thank you all.